Waddell signs. This is Dr. Kevin Trangle. I'm a medical doctor and I am here to give away some trade secrets. Waddell signs are named after a Scottish surgeon born in 1943 who first published in the journal Spine in 1980 5 different categories of signs that leads one to conclude that a patient being examined may have secondary issues and not physiological issues. There could be malingering, there could be symptom magnification, there could be a lot of things that are from the emotional category that are not physiological. Let me share with you what some of these may be. Pay attention. They fall into 5 different categories. There's tenderness is one of them, simulation, distraction, non-anatomical distribution of symptoms, and lastly, overreaction. Let me cover each one of those briefly, and you'll see what I'm talking about. I'm not going to get into all the different aspects of it. Today, there's probably 40 or 50 different signs. Let's talk about the 5 major ones that started this whole thing. In terms of tenderness, if an individual is tender in an area that does not anatomically correlate where the issue is, then clearly this is unrelated to the issue. For example, if you have a spinal nerve root irritation and you're tender over the thigh and that has nowhere to do with any of the innervation of the spinal root, then it's not anything that has to do with the back. Number 2, simulation. Example, we're pushing on somebody's head, we call it axial compression. A light push on the head does not transmit forces down to the lower spine. Anybody that has pain or discomfort in the lower spine when you're pushing lightly on the head, it's not due because there's anything anatomical going on. It has something to do above that in the brain area. It's not physiological. Thirdly, distraction. If you're touching somebody and it's painful, and then you discuss another issue with them, you turn their attention to something else and it's no longer painful, or if they can't remember where you touched them in one place, it was painful, then later on it's not painful there, or if the range of motion changes as you continue to talk and distract them, then it's not physiological. This is another Waddell sign. Another one, in which many of you have heard about, I'll give you a couple actually that are common. We have what's called straight leg raising. If you're laying on the flat on the table and you lift somebody's leg up, you're stretching the nerve in the back. If that's painful for the individual, it will be painful if the same situation occurs if they're sitting up. If they're sitting up and they can lift the leg to 90 degrees, but they only lift it 10 degrees when they're laying down, that's not physiological. That's what we call non-physiological straight leg raising, and it means there's something more than actual anatomical abnormalities. These are some examples of what's going on. If somebody has one more example, the last one is if somebody has, let's say, sensory abnormalities, and you're testing them, and yet it's not in the area that the nerve actually innervates or covers, that's also called a non-dermatomal sensory abnormality. Once again, it's not consistent with actually any true injury. Lastly, as we call the overreaction category. An individual that's moaning and groaning even before you touch them, even before you ask them to move, is typically not indicative of a real injury. If somebody has ratcheting, in other words, you ask them to resist when you have moving your arm and it goes like this instead of a smooth, maybe decreased strength manner, that's also due to voluntary effort to control your range of motion. These are just 5 of the categories that have been described. It's been now over 30 years. These are things we look at. Experienced examiners know about these, and now experienced patients can know about these also. We at Kevin Trangle Associates are experts in these matters. We give testimony. We are able to assess individuals as to the true nature of any injuries. If you have any questions, you want to use our services, please give us a call. We are based in Waddell in Florida, but we do cover the country.